Hi everyone. Thanks for listening to the first episode of our Neuroscience Career Exploration podcast. My name is Janelle Tremblay, and I'm the Vice President Academic for the Neuroscience Students Association at the University of Alberta. Today, we're going to be exploring one career that undergraduate neuroscience students can pursue after graduation, which is occupational therapy. So joining us today is Catherine Lambert, and she's an occupational therapist who is currently working in acute care in Edmonton, completing a PhD in rehab science, and is a supervisor of students at the Parkinson's Association of Alberta. Hi, Catherine. Thanks so much for joining us today.
Hi, Janelle. Happy to be here.
All right. So to jump right in, for our listeners who don't know, can you describe what an occupational therapist is and how occupational therapy differs from similar fields like physical therapy?
Yeah, so occupational therapy is a rehabilitation profession. So we work in healthcare. And what we do is we focus on sort of overarching is facilitating activity in the sense of we are helping individuals do the activities that are meaningful to them. And so, for example, we often overlap quite a bit with physical therapy. Physical therapy will look very much at, for example, motor function, how they might be able to support walking or balance or muscle strength. How we would look at it from an occupational therapy perspective is more in the context of function. So is this individual able to get up and brush their teeth? Is this individual able to play golf, like a sport that they love, things like that? So we really look at it in the context of activity. That's what separates us a bit.
Okay, perfect. That's really interesting. And what does your typical workday look like?
So my workday would vary a lot based on where I am working. So in acute care, you would often be seeing people throughout the day, and you would work from generally around sort of 8 a.m. to 4:15 p.m. And throughout the day, you would, in acute care, be seeing individuals in hospital and assessing their function. So looking at, are they able to get out of bed? Are they able to walk? Are they able to dress themselves? So you're looking at activities that are important for them to be able to be discharged safely from home. So in a typical day, you would see maybe about 7 patients, and you would chart on them and assess to see how they're doing. And then in outpatient rehabilitation, you would have individuals come in to see you typically. And so you might see a few less patients, just depending on, people maybe not showing up for appointments, for example. That happens sometimes. But again, the hours are generally pretty standard, about 8 to 4:15. There are some occupational therapists who also work in the school system. And so then again, that's the similar kind of hours.
Okay, that's really good to know. Definitely differs from some of the other more health-related fields. So would you say you work more in a team in that acute care setting or more individually?
Yes, definitely. So in acute care, I would work very heavily with a team. So in acute care, you would often attend rounds every morning, which would include someone like a charge nurse, a social worker, the physiotherapist, and you would all, and the doctor, of course, and you would talk about the patient, come up with a plan for how to get them home, how to get them healthy, etc. And then oftentimes I would work directly with the physical therapist. So oftentimes, in hospital, people are very sick, and sometimes they need 3 or 4 people to help them move. And so you would work with the physical therapist. There are individuals called therapy assistants who really sort of support the occupational and physical therapist. You would work with them. And you would almost always in acute care be collaborating with them to make sure that what you're doing is you're working together so that you can make sure that the individual meets their goal.
Okay, that's really good to know as well. And is outpatient about the same?
So outpatient, from my experience, is a little bit different. It probably depends a little bit based on clinic to clinic. But from my experience, oftentimes you would just see the individual one-to-one. Oftentimes in outpatient, they're much higher functioning. So if they're coming to you, that means that they live at home. And so probably they aren't as high needs as they would be in a hospital. So they don't often need more than one person. But a lot of the times at clinics, there's an occupational therapist and a physical therapist who work there. And so they may have the same client and they may talk about the client, trade ideas, collaborate on treatment plans, but they may just be less involved with them at the exact same time. So there's still collaboration there, but it's maybe less direct.
Okay, yeah. So kind of a bit of flexibility in how you're working with other people. That's good to know.
Absolutely. And I think that there's also a lot of flexibility too. So even in acute care, there can be flexibility in terms of how often you work with a physical therapist or a speech language pathologist, how often you collaborate. And same with an outpatient. You can kind of collaborate as much as you want to in a sense, or you can work a bit more individually. It depends on your preference. I really love collaboration though. I think it gives me a really good perspective on the client and kind of helps me to learn new things, etc. So I really like it personally.
Yeah. Okay, that's great to know. And what types of settings can you work in as an occupational therapist? I know you mentioned acute care and a little bit about outpatient, but what other settings could you work in?
Yeah, so there are a ton of different settings that you can work in. And this is something I didn't really realize as an undergraduate student. So I work in acute care, so individuals who are very acutely ill, but there are individuals who work in sort of longer stay hospitals that are more rehabilitation focused. So they're no longer acutely ill, but they still need lots of rehabilitation. And in Edmonton, there's the Glenrose Rehabilitation Hospital. That's a really well-known hospital for rehabilitation. And so individuals, say, with traumatic brain injury and spinal cord injury, after they've been sort of medically stabilized, they might go there and do much more intensive rehab. So I said I see 7 people a day in the rehabilitation hospitals. You would see fewer patients, but for much longer. It's much more intensive. Then you get the outpatient clinics where individuals will come into you to work on certain goals. So again, these are individuals who are living at home, so they might be a little bit more higher functioning. Then there's a lot of OTs who work in the school system or who work in pediatrics. So I know quite a few work in the area of autism. So even sort of some not-for-profits, for example, they can be involved in as well. And then let me think of some of the other ones. Home care. Home care is another big one. So this is when you're going into an individual's house and assessing sort of the safety of the home, seeing what you can do to support them living at home for as long as possible. A lot of clients, it's really one of their main goals is to stay at home if they can, instead of, say, having to move into an assisted living area, something like that. And so you look at what you can do to support them. And then the other area that I didn't realize occupational therapists work in as much is actually mental health. So I know a few OTs who work in psychiatric settings. And so this can also be inpatient or outpatient. And a lot of this is looking at things that are a bit different from what I look at in my work. But so, for example, what can you do to help an individual who maybe has been struggling with, for example, they may have had post-traumatic stress disorder, for example, or depression, and they're off work. And what can you do to support them so that maybe they're able to go back to work or go back to school, kind of figuring out activities that you can build into their day and support them in doing so that they can get back to what they need to be doing.
That's really interesting. I actually didn't know that the mental health side was so big for OT, so that's really good to know. Awesome.
Yeah, and one of the things that I would say that's cool about OT is that when we are talking about, we're looking at an activity, there's so many different things that can go into an activity. So, for example, I primarily do research and work with Parkinson's disease. And so we may think a lot of the times about an activity that they can't do. Maybe they're struggling to get dressed, or they're struggling to play golf. That was another example that I know a lot of people have given to me in clinical practice. But yes, we look at their physical function, so some of their motor symptoms. But as OTs, we also look a lot at, so cognition is one of our really big things. So, looking at how their memory is, their attention, their planning, their problem solving. We look at their mental health, so their stress, their anxiety. All of these things really interact together. And so we take what we call sort of a biopsychosocial approach. So we really look at all of these different things and how they interact. And sometimes it's a really straightforward answer, but sometimes there's a lot of different things that go into it. And so it can get very complex. And in some ways that can be very enjoyable because you do a lot of problem solving there. And a lot of the times with individuals, their physical function is okay, but their cognitive function, if that's bad or challenging, that's really one of the areas that's our kind of wheelhouse where we really look at, okay, what can we do? What strategies or modifications can we do to support you and get back so that you can get back to what you needed to be doing?
That's really interesting. So you did touch on this a little bit, but what qualities would be important for someone wanting to go into occupational therapy then?
There's a few different things. To be honest, one of the biggest things is being able and willing to work with people and work as a part of a team. So even if you are working on your own in an outpatient clinic or in home care, we really try to prioritize in occupational therapy that you're also collaborating with your client. So we really try to work on what is important to a client. And sometimes your priorities differ. And so you really need to figure out how to work with individuals. You need to figure out how to collaborate. Another really big thing is communication. So figuring out how to explain to an individual why you're making suggestions, breaking things down, explaining their symptoms, explaining their problems that they have, that communication piece. So I'd say, willingness to communicate, willingness to collaborate are two of the biggest pieces, and also an element of creativity. So a lot of the times when I talk about that complexity of there could be cognition, there could be emotional, there could be physical, there might be social complications going on. And so you may have two individuals with the exact same diagnosis and the exact same problem. And what works with one of them doesn't work at all for the other because they have different little things going on. And so you need to be pretty creative in how you adjust things and be willing to be flexible and be willing that you're working with someone and it's not going according to plan and you just have to shift gears a little bit and get creative. There's a lot of technical knowledge that you need to have to be an occupational therapist, but those are things that you learn over time. But I would say those general teamwork and collaboration communication skills are really foundational, whatever setting you're in.
That's really good to know. Thank you for all that information. That's perfect. And what would be the typical salary that someone in occupational therapy could expect?
So it depends quite a bit. I think in Alberta, the average salary is around maybe $45 an hour. And on the higher end, it's in the early 50s. And when you're starting out, it's maybe the late 30s, maybe sort of like $36 an hour. It does vary quite a bit because some occupational therapists work in what we would call sort of private settings. So they're more so contractors where they own their own business. And so what they get paid may look a little different from what someone who works for Alberta Health Services, a really big sort of public business. Business is not the right word to use to describe health services. Oh my goodness. A large public organization. That's a much better word. Salaries can look a little bit different based on the typical things like benefits, whatnot, and pension, et cetera. But I'd say on average, most people get around $45 an hour.
Okay, really good to know. And as far as your job, what aspect would you say is the most challenging and what's the most rewarding for you?
I would say challenging is related it happens a lot in healthcare. And I think in terms of sometimes it can be challenging working with individuals who really want to get better and improve, but it's just not possible. And so finding out what you can do to support them so that they're able to get as close to what they want to do. But, you can work with individuals, for example, for me, multiple sclerosis or Parkinson's disease. These are progressive diseases, and individuals are really scared and they're losing their ability to do things that they love. And so we can support them as much as we can and make modifications, but that can be really hard in any healthcare setting, and especially with some of these diseases. I used to find it hard when I would work with someone who was quite young and who was very sick, because that's someone who's close to my age, and I couldn't imagine what that would be like. So I'd say that's quite challenging. And then I would say another challenging thing would be anything around cognition can be a little bit challenging, to be honest. Talking to individuals who may have impairments can be really challenging because you really need to be sensitive. And that's something which I think everyone still has to work on a little bit, is how to be sensitive, but still direct, because you don't want to lie to someone if they have substantial impairments, but at the same time, you want to be understanding and empathetic. So that's less of an emotional challenge, I would say, for me, but a technical challenge in terms of figuring that out. And then I would say, in terms of the most rewarding, just seeing people make gains is amazing. And I remember one of the biggest things that I remember when I was a student is working on a stroke unit. And it was an individual who was quite young, he was middle-aged, and he'd had a massive stroke. And so he had significant motor impairments and, had previously been a very high functioning person. And he had very significant motor impairments. So, we were trying to get him back to walking and standing. It was very basic. And he had what we would talk about as, he had very profound aphasia. And so the language centers of his brain had been very affected. And he would often do something called like word salad, where he would often say things that didn't quite make sense. And I still remember the first time being with him, the first time he was able to say something correctly around us and able to pick something out. And I understood him, and just like the look of joy in his eyes. Or for example, with him, seeing him get to stand for the first time. I think we worked with him for 3 weeks, and finally getting him to stand. And there were 3 of us, and we had the mirror, and seeing his face get to see that he was standing again. Those sorts of little things are incredibly powerful, that you're supporting someone. And the thing that's nice about occupational therapy is often you're supporting someone in something that's important to them. And so it's really important to them to improve. And so getting to see them on that journey, it's oftentimes incredibly rewarding. There are a lot of sad moments in healthcare, but the rewarding moments are really worth it.
Yeah, that sounds really amazing. As far as the typical work-life balance in the field, what would you say your work-life balance is?
I would say in general, hours-wise, work-life balance in occupational therapy, it's typically pretty good. I can't speak to individual occupational therapists, but the hours are generally pretty standard in terms of, like I said, kind of 8 to 4:15. There may be some individuals who work on call for some reason, but that's pretty rare. So I would say we have pretty standard hours. We don't really do shift work. But I think in any healthcare profession, it can be hard to have work-life balance, in that sometimes you see some pretty sad things, some pretty challenging things. And finding out how to not take that home with you is really important over time. If you have someone who's working in pediatrics and you're working with a child who is quite ill, for example, or again, as I said, working in something like Parkinson's disease, where it's progressive, or ALS, which is very, very progressive, and finding out how to support them and be empathetic, but then also come home at the end of the workday and realize me thinking about this anymore isn't necessarily going to help them. Is something that you learn over time in healthcare in general, I would say. But in terms of actual hours, the balance is usually pretty good. Okay,
yeah, that's really good to know. I can imagine how challenging that would be, not taking your work home with you. So, for you, what education and experience did you obtain to get to where you are now? And what would you suggest a prospective student should do in order to get to kind of the same place?
So what I did before I went into occupational therapy is I started volunteering with the Parkinson Association of Alberta. Now, I chose to do that because I've always been interested in Parkinson's disease. I had a relative who had it, and so that was always something I was interested in. And as an undergraduate student, I did research looking into something called motor imagery, so really looking at brain activity during sort of motor control tasks. And so I've always been really interested in movement. So I started volunteering there just to find out a little bit more about the disease, about the programs, about the services, to work with individuals who had that disease and see the diversity of it. So I would say that something like that, not necessarily the Parkinson Association of Alberta, but if there is something that you're particularly interested in learning more about, seeing what volunteer positions there are. I know a lot of individuals who are interested in pediatrics, who worked with some sort of autism organizations, cerebral palsy organizations, traumatic brain injury. People would, there's different organizations throughout Alberta that you can volunteer with. And so I think that that is a really good way to also see if you like working with clients, if you can get involved in some way that actually involves direct client work. It doesn't necessarily mean you're doing rehab, but a lot of these organizations have things like, for example, like a buddy system, where you're just working with someone, socializing with them, supporting them. When I volunteered, I helped assist run some programs, some group programs. And so I'd say that's one thing that's really important, is to make sure that you like working with people and that you like working with them sort of in these settings where the individuals may have disabilities and may experience challenges, right? And how do you find that? That's one big thing that I would really suggest. In terms of besides that, I would honestly say shadowing. Obviously, right now that's a bit challenging with the pandemic. So I wish I had a better answer than that. But I know a lot of people who did shadowing and who found that really beneficial. So shadowing someone in a hospital, reaching out to an outpatient clinic. A lot of people have done that just to see what the day-to-day is like. Unfortunately, I know that's a bit limited right now, but hopefully at some point you'll be able to do that again. So I would say those are kind of the main things.
Okay, yeah, that sounds great. And as far as the master's program actually goes, it's a course-based master's, is that correct?
It is, yeah, it's a course-based master's.
Okay, so it's kind of course and then some practicum style learning as well?
Yeah, so it's primarily coursework and then field work. I did a little extra research on the side because I love research, but you generally have to write, I'm trying to remember how they structure it now. I think you generally still have to write a little research paper. You're not doing sort of your own research study. It's more of a literature review, maybe in an area that interests you, but it's not a research thesis in the same way of some of the other master's programs.
Okay, yeah, that's really good to know. And then I know a lot of people, like you were saying, choose a specialty of sorts. So maybe working in pediatrics or more of like geriatrics or different fields. Is there anything you do during your master's to pick what you want to specialize in, or is there a lot of flexibility once you're an established OT?
Yeah, I would say that there is a lot of flexibility. It's a very broad profession in that there's so many different settings that you can work in. And so I definitely think that it's nice to know a little bit about what you might have an interest in. But at the same time, I would say don't feel that you need to restrict yourself. What I tried to do in the program was have an idea of what I wanted to do and make sure that I got a placement that was somewhat related to it, at least one of my placements. So I was very interested in neurology. And so I made sure that I got to work in stroke rehabilitation for one of my placements. But at the same time, I know a lot of people who have worked and who have really sort of shifted from, say, they did home care and then they went into the hospital and worked, and then they went into mental health. There's quite a lot of variety. And so oftentimes I would say don't pigeonhole yourself too early. It's good to try out different things. it's good to be passionate about stuff. I definitely find that one of the biggest divides I found, and not in a negative way, but I definitely found that there were some people who knew they wanted to do pediatrics, and then there were some people who knew they did not want to do pediatrics. That was like one of the strongest differences I noticed. And of course, there are some people who are flexible and were interested in doing both. But that was one thing that I noticed, which is quite interesting. But in general, most of the people were interested just in rehabilitation in different settings and trying out different things.
Okay, yeah, really good to know. And so those are all the questions I have for you. Is there anything else that you'd like students to know about occupational therapy?
No, I don't think so. I mean, it's a career that I've really, really enjoyed. I'm very happy to be an occupational therapist. It's a very rewarding profession. And the nice thing about it is that you get to do a lot of different things with it. And you get to see a lot of different things, which is really, really interesting. So that variety is really nice as well. But yeah, overall, it was a great career choice for me. And I'm very happy being one and happy to talk about it anytime someone wants to discuss it.
That's great to hear. Thank you so much for all the information. I found it super informative and yeah, it was fantastic. Yeah, so that is kind of the end of our podcast or this episode. To all of our listeners, stay posted for our next episode where we will be exploring another career related to neuroscience. So see you next time.